Good morning, good morning, good morning, and welcome to Kaleida Health on Power 96.5 FM, 1080 AM. I'm your host, Francesca Messiah from Kaleida Health, Manager, Workforce Development. And I know I pretty much kind of say this a lot in terms of who is Kaleida, but we may have some new listeners who may not be aware of our hospitals. Our hospitals include Buffalo General Medical Center, Gates Vascular Institute, Oishei Children's Hospital, Millard Fillmore Suburban, Buffalo General Medical Center, also the Visiting Nursing Association, which provides home care for all ages, 24 hours a day, even on Sundays. Also, I don't know if you know that the hospital was founded in 1855. Buffalo General was founded in 1855. And at Buffalo General, we have 29 operating rooms. We have 17 interventional labs. And we have, and in 2024, we had nearly 34,000 patient visits. Also, Kaleida Health does not discriminate, exclude, or treat people differently based on race, color, religion, sex, national origin, disability, sexual orientation, gender identity, or expression of. We don't discriminate on your expression, your physical appearance, nor on your source of payment or age. All right, just wanted to share that with you. But most important today is our guest. Our guest is not a stranger to the program, but whenever I visit a department, I just learn something new about the guest and their department. So our guest for today is Ben Casper. Good morning, Ben. How are you?
Good morning, Francesca. Doing well. How about yourself?
Great. And you know what, Ben? Give the listeners, what is your title?
I work in the trauma department at Oishei Children's Hospital, which is a level 1 trauma center, and I'm the injury prevention, outreach, and education specialist.
Okay, injury prevention and outreach specialist. So you may have run into Ben at a community outreach, and when I say community, I mean part of the 8 counties in Western New York. Am I correct, Ben?
Yes, and actually, we sometimes even are branching out to the northwestern PA area as well.
Oh, okay. So as I say, you might have seen Ben at one of the outreach affair events, either hosted by Kaleida or where Kaleida was a participant. But today, our topic is car seat safety, and not just car seat. See, I don't have children, so I didn't realize all the different levels of car seats. We're going to be talking about car seat safety, booster seat safety, as well as what is it, a convertible seat. That's when the child is older. There's a third type of a car seat.
Yeah, there's a lot of permutations for different kinds of seats. There's like everything from rear facing only or infant only car seats, convertible car seats, which can be faced rear facing and then converted to a forward facing position. There's also all in one car seats, which encompass all of those, and then also incorporates a booster seat, and then there's a booster seat. There's also a combination seat, which is only forward facing. There's a lot, but we can break it down.
Okay, and the way we got started on the topic of car seats is that Ben was sharing with me a book called Francine and Fritz Booster Buddies, and I read it, and it's excellent. It is an excellent book, and only my greatest knowledge of car seats, I've given them or shared the gift for a baby shower. So if
Oh,
you could
nice.
just yeah, so if you could describe your department and the importance of the community. I know I've touched a little on it, but what would you say, like in a few words, your department that's located at Buffalo at Oishei Children's Hospital and how it ties in with the community?
Yeah, no, good question. So the injury prevention department ties into the community by providing resources to those who would maybe be unable to afford some of the injury prevention, protective equipment or gear. And thanks to Gracious Foundation, foundational funds, and people that are donating funds to the cause. Kiwanis is we have an endowment through them, and their continued support is wonderful. We have one that's we're renewing with National Fuel to provide resources. The Governor of Traffic Safety, and Imagine Nonviolence. So it's just we're fortunate enough to provide these services, due to the support that we get, and it's a wonderful thing to give back to the community.
It really is. It's so important. So car seats. Now I know growing up we didn't have car seats. So how long have car seats and booster seats been available for children?
Well, they've been available actually for almost 100 years, but they're gearing them differently. Car seats, back in like the 30s were just a place to put your kiddo, and just make it so they had they could be sitting upright and you didn't have to necessarily hold them. As it's gone from decade to decade, we've kind of focused a lot more just on the safety of the occupants themselves. And so there's been a couple of marked areas where car seat innovation and safety innovation for vehicles has improved. Like 1996 was a really big year. That's when they kind of incorporated the lower anchor system for installing car seats. That's when you had certain safety standards that were kind of standardized. And we're just continuing to make greater achievements, both with the vehicles themselves, because, as you may know or have known somebody, cars, they used to go ahead and they weren't made to crumble in a crash. Now they essentially are, because they're just taking whatever force and prolonging that force over a greater period of time and over a greater distance. So the car takes the impact, so the occupants don't. And that type of technology and innovation has actually gone to the car seats, where there's crumple zones in some of them to absorb some of that impact, so the occupants do not have to.
Yes, amazing. And I just remember, little growing up, my father would we would sit in the front seat, and and if something were to happen, maybe he had to stop suddenly, for instance, he would just take his arm, and I remember he would put his arm across us, and I think they had seatbelts also, but I just remember that, which was also safety, but now, of course, a car seat is much safer. Is a convertible seat the same as a booster seat?
No, they're slightly different. So, like a convertible seat. So the nice thing about a convertible seat is you get a little bit more time out of it, because you can start at a rear-facing position, then transition to a forward-facing position, but you still use the harness system of the car seat to restrain your baby or child in that. You transition to a booster seat when you're at least 4 years old, and about most of them you have to be over 40 pounds. And all it does is it's a positioner. So it just takes the occupant and makes it so you're taking that smaller occupant and you're making it so they fit a traditional car seat belt. And so all it does is kind of position you so that your lap and shoulder belt are over the big bony structures in your body, pretty much across your hips and your pelvis there, and going across to your shoulder and across your breastbone.
Okay. Now, I'm assuming that data shows that car seats are proven to save lives of children. And I guess my question: how long does a child? Because I didn't even notice till recently how babies have to look at the back of the car. How long and why? I'm sure there's data on it, but why do little babies have to and how long do they have to look at the back of a car?
No, good question. So a couple of different ways to look at that, but we'll think about it this way. Where do you travel the fastest when you're driving a vehicle? You drive forward, right? So if you're rear facing, so facing the back of the vehicle, then if you were to have an impact at a, say a significant speed, the back of that car seat is helping to support the head, the spine,
Oh, I see.
and yeah. So like that's the major thing. It would, I guess, if you were to think about it, it would be safest for everybody except for the driver, obviously, because they have to see, be rear facing or have be positioned in that way. However, good luck because not too many people they want to they want to see what's going on around them. So one common misconception is that you're graduating to the next step, and then that should be safer when it's actually every kind of step that you go throughout being an occupant in a vehicle is, I guess, less safe than the previous step. So it's encouraged that you stay within the first step and you stay there not until you reach like an age necessarily, but you max out either like the height or the weight requirement of that seat.
Yeah, I have a little cousin who every time you strap her in, she makes this little noise, and then it goes away. So like no one likes being strapped in, but it's like, sorry, little baby, this is for your good. Um, Now, something else that I recently read about, talking about, so you're driving along, your child is either facing back, in the front, and I think it said 6 months, up until age 6 months, you should ride no more than 2 hours with a child in a car seat. Is that true?
Well, you want to take some like frequent breaks. And the big thing is like if you think about, little babies, so like birth to like 4 months or so, or maybe even 6 months or so, they really don't have the strength to support their own head. So you want to make sure that you have the appropriate recline angle. That's probably like one of the most important things. And you also think like you want to get that baby up and like moving around, stimulated a little bit. Especially in like a car that's, kind of, you get cramped up. Even adults get cramped up a little bit. And
Right.
so taking a little break, just checking the positioning, making sure. And you know what? Like, if you have a baby that young, you probably have a diaper to change anyway.
True.
So that's one of those things that like you just want to make sure that you're, taking frequent breaks and just making it so that you're able to kind of interact with your little kiddo. Yeah, every couple of hours is definitely advised.
Okay. All right. And I think that it says not only every couple hours, but it's to take them out and move their muscles around, just like we would do as an adult driving. You get out and stretch. So you want to, stretch your little or massage the muscles. So it's not just taking them out, but it's also um, making them comfortable and just giving them a little massage. I mean, that's what I just read yesterday in the literature.
Yeah.
hmm So, what are some of the common mistakes that people make with installing car seats and strapping the child in? So, what are the and what should they do if they have questions? But what are some of the more common mistakes? Because your office is right there in the emergency room, so I would be willing to guess you've seen a few children who weren't strapped in properly. I'm just taking a guess because of where your office is located. But what are some of the common mistakes that people make with installing car seats?
Yeah, good, great question. So like there's a couple like well what we already talked about like premature like transition. So transitioning a kiddo to an inappropriate seating position too early. So like New York State has a law in place, not just like an advisory, but a law that you have to be rear facing until you're at the minimum 2 years old. But the best recommendation is to make it so that you are rear facing until you outgrow it by either like the seat by either weight or height. Another thing that we commonly see, especially for those convertible seats, the ones that can be rear facing and then transition to forward facing, some people don't. You have to use a different belt path in order to secure the car seat to the actual car itself. And also there's usually a top tether, so an additional strap for forward-facing positions. And some people, because they didn't use it for rear-facing, don't use it for the forward-facing position. Another one is just you have to check the main thing to keep yourself protected is to check the manual of both your car seat and your car itself, and you can follow those recommendations. Sometimes if you use the lower anchor system, those little hooks that are located in the bite of the seat, a lot of times you're not able to borrow. So you're not able to use the center seating position and use the lower anchors. You could then maybe use like a lap and shoulder belt to secure the seat. And then one last thing is some people think that, well, if one is good, then both is better. But for most car seat manufacturers, you're only supposed to use either the lower anchor system to secure the car seat to the vehicle or the lap and shoulder belt. And you just want to make sure that it is locked into place.
So you're saying that you shouldn't use lower anchor and lap and shoulder together. Is that what you're saying?
Correct. And in most cases, there are some manufacturers that allow that. But as a general rule, but again, you'd have to check your manual. But as a general rule, you're supposed to use one or the other.
Mm-hmm. So then, okay, I'm just going to say for a 2023 car, what would they have for that car seat? Don't they have something in the back that you're able to strap something through to anchor your car seat?
Yes. So they have some they have the like lower anchoring system that is in place, and even for cars that are a little bit even older than that. So that kind of legislation went through in in the 90s, and then it was a requirement that all cars had to abide by that by the early 2000s. So most cars on the road have those capabilities, which is nice, obviously. And there's also like different thresholds for weight, because if you look at the lower anchor straps, they're not as strong or as thick or as wide as a seatbelt strap. So once your child reaches a certain age, and that'll be on the car seat, and they'll also have indicators in your owner's manual of the vehicle, of when you have to use the seatbelt and you cannot use the lower anchor system.
Mm-hmm. You just triggered a thought. I'm seeing more people on their bicycles with babies, and they have all different ways of attaching like a little harness almost to the bike. Are you familiar with that and how and the safety of that?
I've seen, yeah, there's some like there's some like bike trailers that the child can go in. There's also some where like a seat affixes to like the bike and they kind of ride behind. Even seen some where like we're kind of riding in front. Um, I would probably avoid that if possible, and especially like if you're going to be in traffic or in a heavily populated area, uh, just because you're already trying to focus on the road, you're trying to focus on the environment around you, but then also children are they're a little unpredictable, and
Right. They're
that
curious,
they're going to
curious.
and they're going to draw your attention away from other, potential obstacles or something like that. So, I would tend to avoid doing that, just because of all of the distractions, both for yourself and that a lot of motorists are distracted. They're not supposed to text and drive. They're not supposed to do a lot
Right,
of things,
right,
but
right.
but we see it on a day-to-day basis. So. That's kind of my 2 cents on that.
All right. Okay. I just had to ask that because you triggered that thought. Back to a car safety, and selling a seat. You do a lot of those clinics throughout the year, right? Safety and how to in selling, or you're also able to help individuals with installing car seats. How would someone find out that information if they're listening, their child's getting ready to be born next week, and they are a little frazzled about installing the car seat? They want to make sure it's perfect. How would they reach you and find out about these classes?
Oh, absolutely. Yeah. So it's by I do a lot of like remote work because I'm out and about in the community and different things like that. So email I always have access to, which is B as in Ben, Casper, KASPER one, the number, at kaleidahealth.org. Or you can reach me and leave a message or call my office phone at 716-323-2624. And could be happy to set you up. I do appointments as it fits into the schedule, and happy to get you situated. But also, there's well, actually, I'm going to the West Side Community Center right after this call,
Oh, you are okay.
and I'm going to help out one of our affiliate organizations, Epic, to give some car seats away and to kind of go ahead and kind of work with the community. But going to like a Safe Kids website and looking for that, or the GTSC website, you can look for fitting stations that are available throughout the community. And they'll also link you up with technicians, and you can kind of locate. There are quite a few that happen on a fairly regular basis. So just going onto those particular sites or reaching out to myself. I'm the representative for like kind of Western New York for the car seat initiatives through Governor Traffic Safety. So and through the Child Passenger Safety Board. So yeah, there's a lot of opportunity out there, but usually more so during the warmer weather months, because a lot of these things happen outdoors, and well, winter is coming.
Buying a new car seat or buying a used car seat. If someone's buying a used car seat, what questions should they ask?
Yeah, so like one of the things, if you don't know and trust the person, I would discourage you from just purchasing one off of like, say, Facebook Marketplace, or going to a secondhand, child store or something like that. Just because you don't know the history of the seat, you don't know if it's been in an accident, you don't know if it's been altered in any way. Um, that's going to be a little bit different from like a family member that you know very well, and it's going to be very honest with you. Um, because then you can ask the questions, and believe it or not, car seats do have expiration dates too. Usually
Oh,
located kind of on the bottom of the seat. They give you the manufacture date, and then sometimes they give an expiration date. Sometimes you kind of have to look it up. It's usually, they last for about 6 years, up to about 10 years or so. And that information is just kind of a little hidden. And but it's present on usually like kind of the bottom of a seat in an inconspicuous spot.
okay. And also, listeners, even if it is a family member that you love and trust, you may not know everything that's happened. So, what if that car seat has been in an accident? What does that mean?
Well, it generally means that you cannot use it, or it's not recommended by the manufacturer. So each company has different specifications on. Some say that like, oh, if your seat was involved in any car accident whatsoever, replace it. Others have certain specifications, like there can't be an airbag deployed, can't be on the impact can't be on the side of that. There has to be no injuries to any individuals in the vehicle, and the car seat has to not show any like damage, things along that line. So there's different stipulations based on the car seat manufacturer. But if you ever are in a car collision, listeners should know that if you have a car seat that's in there, that's oftentimes that's covered by your car insurance company as well. So you want to make sure that you include that when it comes to like damages to your vehicle.
Oh, okay. Well, that's a great point, Let's talk a little bit about Francie and Fitz, booster buddies. What, and you said that you have a few copies that you can send for, to people for their school or church group for who have young children like that.
Yeah, so the author actually is a Buffalo native, and Fitz is part of the title there. Is
Uh-huh.
that actually kind of named after when she lived in Buffalo. Um, Fitzpatrick was a shining light there for our Buffalo Bills at that time. So that's where that name came from. And she was traveling with her daughter, and they were in a pretty significant collision. She was wearing, or she was positioned in a booster, and because of that, because it took those crash forces, and it put him over like the bony structures of her body, and
Mhm.
they say that it was said that helped save her life actually, and. So she's very passionate about child passenger safety in vehicles. She actually helped and advocated for a booster law. She lives now down in Georgia, and now there's a booster law that's in Georgia. And actually, just to mention too, like so, is a New York State specific law that for all children that up to 8 years old, it's a law that you do have your child in appropriate uh, child passenger safety restraint, or AKA car seat. So just something to kind of keep in mind. But the story, Francie and Fitz, is it's kind of looking at the positive things that come out of being positioned in a booster. You get to see out the window. You can kind of it keeps you safe, because that's really right around like that second grade to kind of third grade area.
Mhm.
You start seeing a fair amount of people that are transitioning their kids into a traditional car seat when they're truthfully not tall enough.
Yes.
Their bones are not firm enough to withstand some of those impacts, and so it's just to kind of a different angle, a different way to make a story out of it, to hopefully entice kids to want to be in boosters and want to be safe as they travel.
Thank you. And on that note, what are 2 words or 3 words you'd like to leave with our listeners?
Well, just enjoy this great weather while we have it, and stay safe. But if things do happen, we're a 24/7 shop at Oshaya Children's Hospital, a level 1 trauma center, taking care of your needs from birth to 18 years old for our traumatic patients. And go Bills.
Well, Bill, if they have any questions to ask you about installing the seat or they're not sure, how can they reach you again?
Yes, so it's to be B Casper 1 at kaleidahealth.org. So it's B Casper, it's like the ghost, but spelled with a K.
Right.
1 at kaleidahealth.org, or 716-323-2624. That's 716-323-2624.
And again, Ben Casper has been our guest today for the first half hour of the Great Lakes Health Program, where we talked about car seats, booster seats, convertible seats. If you miss the interview, if you're just catching this part of the interview, in a couple of weeks, go to the Kaleida Health website and Google Great Lakes Health radio program, and you'll hear this interview. So this interview lives on the Kaleida Health website. And Ben, I want to thank you so much for being our guest.
Thank you so much for having me.
All righty. Take care, everybody. Stay tuned. 30 seconds is our second interview. All right. Bye-bye. Thanks, Ben. And now on to part 2. Hopefully, many of you heard the first part of the show. Well, now welcome to the second part of the show, where we'll be talking with Dr. John Selleck about COVID and vaccines. So not just about the COVID vaccine, but a general conversation about COVID and vaccines, just keeping you safe. We want to make sure our listeners are safe, whether you've been listening with us for several years or the past months, or if this is your first time. So I want to say good morning, Dr. Selleck. How are you?
Morning, Francesca. I'm good. Thanks for having me back.
Oh, you're welcome anytime. And Dr. Selleck is you know what, Dr. Selleck, what is a DO? I forgot. It's a doctor of
Osteopathic medicine. Yep, just like an MD.
just like an MD, but and he also has his master's, and he's a hospital epidemiologist here at Kaleida Health, and he's also the professor of medicine for the Division of Infectious Diseases at the UB Jacobs School of Medicine. So any listeners who might be in med school or might know of someone going into med school or even nursing, infectious diseases are one of those topics and epidemiology that have been around since the beginning of time, I'll say. So on that note, Dr. Selleck, if you could just please explain your role as an epidemiologist in a hospital environment.
Yeah, it's basically doing the same principles that community epidemiologists do, and that's the who, what, where, when, why of diseases. In my case, since I'm an infectious diseases physician, that's my interest. So we're concerned about infections that come into the hospital, infections that might get transmitted in the hospital, and the effect on patients, visitors, and everyone who works in the hospital.
And I have to ask, I know soon I'm going to be visiting someone in a hospital out of the state, out of state, and someone had recommend wearing a mask for visitors. We talk about infectious diseases, which is infection. How important do you feel that wearing a mask is for a visitor in a hospital?
Well, I think that, certainly there's been a lot of controversy over mask use, but we do know that it does, number one, help prevent anybody who is already sick from spreading it to someone else, but also will protect you against those things that, may be spreading in your direction. So the question is, should we be wearing these all the time? And believe it or not, there are colleagues of mine around the country who believe that we should always be using masks for patient care. I'm not sure that's completely necessary, and it's certainly very problematic when it comes to communication because we have people who are hearing impaired, people who may have other disabilities where putting the mask on them may make it very difficult for them to communicate, and that also generates an issue of safety in the hospital. But certainly, when we get to the point, as we will over the course of the next couple months, when the viruses start spreading a lot, influenza and COVID and RSV, then it behooves us to wear a mask. And when I see patients in my clinic who are coming in with respiratory illness, I always wear a mask because I don't know what they have. And our clinic asks anyone who is sick with a respiratory illness to wear a mask. And in the hospital, we tend to do the same kind of thing. So I would encourage people, number one, if you're really sick, you shouldn't be coming to the hospital at all to visit. I mean, if you're sick and you need to come to the hospital for medical care, that's why we're here. But in terms of visitors who are sick, we would prefer that you stay away unless there's some very compelling reason for you to be there. And then if you come to the hospital, you should wear a mask. We for the most part don't have too many mandatories, but we highly encourage it. We have masks at all of the entrances. You can get a mask on a nursing unit or in a clinic. So I think there's, in the right circumstance, there's a lot of benefit.
Yeah, and I was just going to say to someone, if you're coming to the hospital and you need a mask, there are plenty as soon as you walk in the door and on the nurse's floor. So thank you. When we talk about vaccine, and we've heard a lot about vaccines, what is a brief history of vaccine and their importance in this country and all really their importance, period, and safety?
Yeah. Yeah. If you look at the word vaccine comes from vaccinia, which was the very first attempt to immunize people, very famously Edward Jenner with the cowpox to prevent people from getting smallpox. So we've moved forward from there. That was kind of a crude preparation that he used. But since then, and especially in the United States, since say the middle of the last century, so for maybe the last 75 years, we have had many very safe, very effective vaccines that have been developed for the diseases that cause, significant amount of morbidity, medical sickness, but also mortality. Obviously, we're fortunate that smallpox is a disease that we're able to eradicate from the world. Unfortunately, we are nowhere near that with other things like measles and influenza and COVID. So that's why we continue to develop those vaccines. And they're really, the safety profile of all of these is very, very good. These are not crude preparations like Jenner's original cowpox vaccine. They're very safe. They're very well tested, and they work very well. They don't always prevent 100% of people from getting infected, but they prevent many people from getting infected, and they prevent most people from having severe disease or dying.
Mm-hmm. Yeah, thank you. And I don't think I'm familiar with cowpox, so I'm going to have to look that up.
Yeah. Yeah. Well, that's, smallpox is the human disease. The cowpox is the parallel disease. But there's enough cross reactivity there that Jenner actually used the cowpox to generate immunity against smallpox. And again, we eradicated that disease from the world several decades ago. So it shows how effective it is. And that was a very devastating disease.
Yeah, I've heard of, smallpox, yes. Next question. So are COVID, flu, and RSV contagious?
Yes, all of I always call them the crummy little RNA viruses. I have to be careful with, the adjectives, but influenza, COVID, respiratory syncytial virus. There are a whole bunch of others that we don't talk about too much, like metapneumovirus and parainfluenza virus with kids. These are all very easily transmitted from person to person, especially when people are, when they're at the point where their illness is the greatest and when they're in contact with other people, say at home or in a classroom or, at work where you're very close to other people.
Mm-hmm. So for COVID, flu, and again, RSV, are there overlap in symptoms? And I just recall last year when a friend said they had the flu and that they would rather have COVID because they said they were so sick from the flu and they thought the flu lasts longer than COVID. But, that was just conversation. There wasn't any fact behind that.
Yeah, it's clinically, it's very difficult to separate these out. And it depends, many times what happens, it depends on what the strain of virus is that's circulating in a given year with influenza. So if it's one that's significantly different from what we have experience with in the past, then the disease may be more severe. We saw this with COVID as we went through that iteration of all of the the different strains of COVID that we saw in the early 2020s. When you get exposed to one that you don't have any pre-existing immunity for, the disease may be worse. But clinically, it's very tough for me to look at an individual patient who comes in with fever and cough and muscle aches and say, wow, this is COVID, this is flu. A lot of times you have to rely on what's circulating in the community. So if you're in a busy a busy flu season and they come in with those symptoms, it's more likely they're going to have flu. If it's during a COVID outbreak, then it's more likely they have COVID. But a lot of times it's very tough to tell, which is why we kind of reflex to testing right away, because that's what's going to give us the answer we need.
Who should get the COVID or the flu or the RSV vaccine? And are there any other vaccines that people should consider getting?
Yeah, the short answer would be everyone, but that's not completely true. But influenza, everyone should really get a flu shot. The people who are at higher risk are people who are older, people who have multiple medical problems, significant medical problems, but also young children, 2 years of age and under, are in a group that tends to have worse outcomes when they get the flu. In fact, the CDC and the state health department track hospitalizations and deaths for young children. So, like I said, especially older, medical problems, and young kids. Pretty much the same thing with COVID. The disease tends to be worse in people who are older, in people who have multiple medical problems. In spite of everything that's been flying back and forth in the media, we know that even people in their 40s and 50s who have medical problems have worse outcomes with COVID. So getting the vaccine is important. And again, young children are also at higher risk of having a severe COVID. And then RSV classically is a disease of children. And it wasn't until we started getting all of this, kind of high-tech testing in the laboratory that we see that older people, especially as you get up into your 70s, tend to have a much worse time with RSV. So again, any of your listeners, if you're in your 60s or 70s, if you have high blood pressure, diabetes, heart disease, chronic lung disease, asthma, you should be getting all three of these vaccines. And again, young children under the age of 2 should be getting these vaccines. And in between, a lot of it's going to be an individual kind of decision that you should be making with your family doctor, and having a good discussion about what your risks are if you were to get infected with one of those, and then getting the vaccine to try to prevent that from happening.
Mm-hmm. And you talk about having the conversation with your family doctor. I would also say, and to have it with your family, because if they're in because if it's a multi-generational family, it could be that no one thought about that older relative in the house who doesn't get out as much, who may want that flu shot to protect them from the other family members who are in and out of the house, or vice versa, however that goes.
Yeah, no, and I think that's a very good point, because we know that the average 20-year-old might say, "Hey, this is no big deal," but if that 20-year-old's parents are in their 50s, and again they have heart disease, lung disease, or as you mentioned, with multi-generation families. So if grandma or grandpa live with you as well, and they're in their 70s or 80s, and they also have chronic diseases. So even though flu or COVID may not be too much of a problem for you, they would be a big problem for the other people in your family. So in that setting, it's best for everybody in those households to get those vaccines.
Mm. Yeah, thank you. So now this is again talking about the media. If someone received a vaccine within the past 2 years, is it necessary for them to get it again? And with the vaccine, um, where would they go? Like if they may have forgotten where they got it last time. Is there any special place to go for a vaccine?
Yeah, so it's basically with all of these viruses, the immunity that you get from the vaccines is with these respiratory viruses, the immunity from the vaccines is reasonably short-lived. Plus, the viruses are constantly mutating, so that's why we get a flu shot every year. And each year, the formulation of the flu shot is different based on what strains of the flu look to be circulating. We're getting into that same mode now with COVID shots that we know that there's a constant movement of the the genetics of the SARS-CoV-2, the COVID virus. So this is another one you should be getting every year. RSV is not quite clear yet, since it's such a new vaccine. Not quite clear how often this needs to be given. Uh, Especially in older people, it may not be in every year, but the flu and the COVID definitely we should do those every year because the immunity is not long lasting and the viruses are mutating.
Mhm. Now, is the RSV the same as a pneumonia shot?
The which one?
The RSV, because you
No,
talked. No.
RSV is no. That's a good point too. RSV is a virus. The pneumonia shot is to protect you against the pneumococcus bacteria, Streptococcus pneumoniae, which is one of the common bacterial causes of pneumonia. That's a separate vaccine that does not have to be given every year. But again, you should have your discussion with your provider about making sure that you're if you're in the proper categories, which again, people over the age of 65, everyone should be getting it. People younger than that, it's going to depend on underlying diseases. As far as where to get it, I always like it when things are done at your primary care doctor, your primary care provider's office. I like it when everything is together and you have one person taking care of you. The problem is that some of these vaccines, especially the COVID vaccines, require special handling and special, freezing and refrigeration. So we've pretty much for the last couple of years been relying on pharmacies, whether it's one of the big chain pharmacies or whether it's pharmacy at your grocery store or big box retailer store. We did, and again with all the confusion that happened with the things coming out of Washington, Governor Hochul did get us back on track in New York. So you can get these at your pharmacy. Just bring your insurance card with you, and you'll be able to get the vaccines that that are proper for your age and medical problems.
Mm-hmm. And I know listeners, one thing I bring up in many of the Great Lakes Health radio shows, sometimes people are afraid and they're afraid it might hurt. They're afraid. I mean, there's so many things that people say that they fear with medical care, including a COVID vaccine. But I get the way I look at it is that even if it bothers you for a day or two, long-term COVID is real. People who had COVID a few years ago when it came out, it's real. You don't want to get COVID, you know. You don't want to get the flu. You don't want to get RSV. So if it means a little bit of discomfort, versus long-term illness, how do you feel about that? People who are fearful.
Oh, absolutely. These are all these are all injections. So yes, you're going to be a little bit sore for a couple days, which is usually a good sign that your body recognizes that something that it's not supposed to be there, and starts developing an immune response to it. But unfortunately, we're subjected to so much uh, kind of scare media or whatever. You
Yes.
shouldn't do this, you shouldn't do that. There's no link with these vaccines with autism or anything else. The disease is always worse than the vaccine. And even with some of the side effects, where you say, well, someone may have some particular side effect. If the vaccine causes that side effect, the virus causes that set of symptoms even worse. So the idea is that it's always to your benefit to get the vaccine. They are all extraordinarily safe. When you look at the literally tens or hundreds of millions of doses of all of these vaccines that we've used over the last several years, the the likelihood of having a very significant side effect to the vaccine is extraordinarily low, and the protection that they provide so that you don't get the disease and potentially get seriously ill or even die from it.
Hmm. Yeah, and I know recently someone had mentioned to me, and I'll tell you what my reaction was, that African Americans are getting sick because they're taking the COVID vaccine. And my response to them, have they been to their primary care? Could it be they haven't? And this person didn't know if they had or hadn't, but it was just one of those I call a myth that's floating out there. Because for someone to say that being African American, getting a COVID vaccine and getting sick, I just thought, I mean, everyone is entitled to their own opinion, but my response back to that person was, has that person been to their primary care physician? Because it could be that there was something that was going on all along, and they hadn't been to their primary care. I mean, I don't know if you've ever heard anything like that.
Yeah. Now we unfortunately, there are two parts of that. The first part is the disinformation that you get from the anti-vaccine people, saying that, the vaccines are targeted against the Chinese or they're targeted against African Americans. That's all absolute nonsense. There is no way. The human immune system is the human immune system. It doesn't matter what color your skin is, or where what continent you live on, or whatever. The immune response is going to be the same, and there's nothing with targeted. The second part of it is the one that you point out, and it's one of those logical fallacies. Well, gee, Grandpa had a heart attack 2 months after he got the COVID vaccine. Well, Grandpa's 85 and he was a smoker and had high blood pressure and uncontrolled diabetes. The COVID vaccine had pretty much nothing to do with Grandpa having the heart attack. Uh, Especially the further out you get from it, and again, we have to continually try to educate people that these are not meant to be population control or genetic control, and they're not meant to harm people. These are very good, very safe products that serve a very important function, and will prevent you from, in most cases, from getting very sick.
Hmm. And just because you went to Dr. Google, remember, Dr. Google did not go, he or she, Dr. Google did not go to medical school. They have no license. They have no proof. It's just whatever that search engine is, But Dr. Selleck, we have about 4 more minutes, a little around 4 more minutes, 3 to 4 minutes left. Anything you want to share with our listeners that we haven't covered?
No, I think that we hit the high points. The vaccines are very beneficial. Um, we're doing some traveling next month for a wedding and some other family things. And before we, both of them are going to require plane trips. And before we head out to the airport, we are going to have we're going to get vaccinated. We want to have fun on these trips, and we don't want to get sick. We don't want anybody else to get sick. So I think that everyone, if you have if you have an appointment with your primary care provider coming up, again, discuss the vaccine, see if you can get them in the office while you're there. If not, check and see where your local pharmacy, like I said, whether it's a freestanding pharmacy, big box, grocery store, whatever it is, that you get yourself an appointment and get vaccinated before the viruses start circulating.
Mm-hmm. And I have to say, I received my vaccine from one of the large corner pharmacies. However, I did check the grocery stores, and some of our large grocery stores are also offering the vaccine. And if you go online, you can set up an appointment to see what time, even Sundays, they take on Sundays, they have early appointments. And if you don't see the time slot that you're interested in that appointment, just where it says appointment, fill in the time that you want to go. And 9 times out of 10, that time is out. It works. It works. So, your local pharmacies, your grocery stores are very flexible when it comes to you coming in and getting the COVID vaccine. And also, don't forget your insurance card.
Yeah.
Don't forget that.
Absolutely. Yep.
Yeah. Okay. Well, I think that is about it, unless, and this is only adults. I want to say today's show, we are just talking about adults and vaccines. We're not, we did not at all talk about children, correct?
We're talking about mostly adults because it turns out that with kids, pediatricians are real good with making sure that their kids get, that their kid patients get immunized. And most of the routine pediatric vaccines are available in the pediatrician's office or the family doctor's office, whatever. And again, check with your whichever pharmacy that you want to go to get a shot, and make sure that they're prepared and comfortable to give vaccines to children. But because the pediatricians have been real good with vaccination, so that usually gets taken care of.
Yeah. Well, thank you, because I wasn't clear in the beginning of the show to say we're referring to adults for this program as we discuss COVID, flu, and RSV. We're referring to adults. But on that note, Dr. Selleck, I want to say thank you so much for being our guest on the Great Lakes Health Radio program. I know it won't be the last time, because vaccines are an ongoing conversation.
The viruses aren't going away.
Virus and epidemic, it's an ongoing conversation. So I want to thank you again. And listeners, I want to say next week, you will hear from my esteemed colleague, Cindy Bass from Erie County Medical Center. And until then, you've been listening for the past hour to Francesca Messiah, Manager, Workforce Development at Kaleida Health. And I want to say, be safe. Thank you for listening. Take care of yourself. Bye-bye.